I'm going to go ahead and start us recording. And so we have all of the pieces moving that we need to. So as we said, this is our third state legislative training, and we are very excited today to talk about messaging for impact. We're going to talk about how you can shape your message to be able to speak to different audiences, and not just how you can, but how you should shape your message. And we are very fortunate that we have Tana with us, who's going to share some tips, as well as some personal experience about how she has shaped messages to be really effective down in Texas. So really, really fortunate to have Tana with us today. Thanks for checking in. If people just go ahead and put your name, your pronouns, your location in the chat box, that'll be great. And we're going to go ahead and get started with our presentation in just a minute. For many of you, my name is Barb Cardell. I am the training director at PWN. And as you might know, being involved in state legislature is something that we have really focused on, especially since the tail end of last year. And Brianna Diaz, who is our policy director, has led a number of really great webinars that have talked about both how you understand state legislature, how it works. It's a little bit different than the federal, as well as how a bill makes its way through your state legislature, as well as a call to action for HIV advocates and allies to be involved in state legislature. For many of us, we often partner with AIDS United and have showed up at AIDS Watch and have had an opportunity to both advocate as well as meet our federal legislators, our representatives and our senators. And what we now know is that, and what we've actually always known, is that we can be incredibly effective when we are advocating at our state legislatures. And hopefully at some point in time, we'll be able to go and meet with our legislators at the state level in person as we move forward. Hopefully that'll happen this year, if not next year. And that oftentimes the policy that is made at the state level has more impact on the day-to-day lives of people living with HIV. And so we've been building out this skills working session to really share both tips and tricks and knowledge, as well as to develop a strategy for when you're going and talking to your state legislators. So hi everybody, welcome, and we're just asking that everybody check in the chat box and go ahead and share your name, your pronouns, and where you're from. Looks like we have quite a few people who have gone ahead and started putting their information in. Welcome all, and again, thank you so much for joining us, and we apologize for the technical difficulties, but we are very excited to have you joining us. Many of you might be a bit surprised to see me here. I was not planning on presenting today, but we actually, you can go back, Jenny. But Brianna Diaz, as I mentioned, our policy director, is actually right now working with both ECHO Virginia, CIRA Project, PWN, and Equity Virginia, because there is a bill that is being heard in the Judiciary Committee today on the Senate side that is addressing HIV criminalization. And so we are very excited to both have that living example of a state-based legislative initiative, and we also are a little sad that Brianna is not able to join us today. But just want to call out and congratulate our advocates in Virginia for having this Virginia HIV criminalization bill moving forward in the Virginia Senate. So again, thank you for joining us. We're going to be talking about messaging for impact today, and it is our third part of our state legislative advocacy training series. Next slide. I'm Barb Cardell. I'm the training director with PWN. Also presenting today, we've got Jenny Smith-Camejo, who is our communications director. And we have Tana Pradilla, who is a board of director, member of our board of directors for PWN. She's a PWN member spokesperson. She is part of our Texas chapter. She is also part of the Texas Strike Force. I always laugh because I'm like, Tana, there's just not nearly enough space to list all the incredible things that you do. And she's going to be sharing a little bit of her knowledge and her experience with us today, which is really exciting around shaping messaging for state legislators. Next slide. What we're hoping to accomplish today is that we want to share with you an understanding about what a message is and how important it is to our issues-based legislative advocacy. We also want to talk about different audiences and how, when you're talking to different audiences, you need to shift your message. So how you talk to community is very different from how you talk to state legislators. You need to make sure that they have certainly a little bit more information about HIV. You might need to do a little bit more educating, but also saving it in general. And that's how to develop a message. Jenny's going to take us through really some basic steps so that we can, instead of just saying something and, oh, that's my message, be intentional about how we shape it. And then finally, we're going to have next steps for developing or adopting a message, especially when we talk about the issue that you are working on or that you care strongly about. PWN is the only national organization that is led by and for women and people with trans experience living with HIV. We've been around since 2008, which makes us a tween, which I always kind of laugh at because we are indeed still sassy and also developing so much experience. We come from 28 diverse women living with HIV, including women of trans experience from our forming back in 2008. And we have nearly 3,000 members nationally, as well as our allies and our partners. We have chapters across the United States, and we also have state leads. And many of these groups are getting ready to lead state-based advocacy issues and initiatives in their area. And so if you are interested, there is a way you can sign up, and we will make sure that you get connected to leaders in your area. And again, our mission is to prepare and involve women living with HIV in all of our diversity, including gender identity and sexual orientation, in all levels of policy and decision making. So this is part of our strategy, is to make sure that everyone has the skills that are useful. Next slide. All right. So this is now our third webinar in this series for our state legislative advocacy series. In our first one, we talked about the difference between federal and state legislators. We talked about how a bill goes through many of the state governing bodies. We talk about why it is so important in legislative advocacy for us to bring the voices of people living with HIV and communities impacted to our state elected officials. We also learned what issue-based advocacy is, and we especially talked about two key frameworks: racial justice and gender justice. And then on our second webinar, we had an example from Colorado from the 2020 legislative session, where we talked about an access to PrEP bill that went through and gave some very specific steps about where our voices were most important, which was through the entire process, and also how we were able to shape that message to ensure that it included racial and gender justice lenses that perhaps were not originally part of that planning. We'll go ahead and put a link in the chat that has a link to the recordings from these past webinars. If you want to go back and refresh yourself, it's some pretty powerful learning. And with that, I will go ahead and turn it over to Jenny to get started on messaging and messaging for impact.
Thank you so much, Barb. And yes, I apologize again for the late start, and also I had created this slide deck that had all of these beautiful photographs and graphics and images in them, and somehow about 15 minutes ago, all of the pictures have disappeared out of my PowerPoint. So I'm kind of upset about that. So just apologies in advance that the slides are not nearly as beautiful as they were intended to be and as I worked on. So it's going to look pretty plain Jane, but we will try to keep it interesting for you anyway, despite the disappearance of my photos and GIFs and everything else that was in here. So yeah, let's go ahead and Where we're going to start is with talking about audience, but even before we do that, two quick things. So number one, please feel free to use the chat box to engage with each other, to share, commentary or your own experiences, etc. If you have a question that you would like for one of the panelists, so me, Barb, or Tana, to respond to, please use the Q&A box instead of the chat, because it's going to be a lot easier for us to keep track of questions, because we may not, be able to answer them the minute that they come into your mind, but we will do our best to answer them later. So again, if you want one of the panelists to answer a question, please put it in the Q&A box, not the chat box. And also with that, I'm going to go ahead and launch a quick poll question just to see who's in the room with us. So here we go. You should be able to see it now. So the question is, have you ever spoken to a state lawmaker about an issue that affects you or concerns you? And just as a reminder, we're talking specifically about state legislators here, so not your member of Congress. If you've been to AIDS Watch, you've probably talked to your members of Congress or to senators. But here we're talking specifically about state legislators, so your state House of Representatives or your state Senate. So it looks like we've got so far, let's see. It looks like a majority of folks have, but there are a good number of folks who have not. So that's really good to know. We've got some folks with a little more experience and maybe some folks with less. And I think we can all learn from each other. Great. So yeah, it looks like as of right now, 68% say yes, they have, and 32% say no, that they have not. Good to know who's with us. Okay, so with that, before we even really get into what a message is and what makes a good message, I really want to give some consideration to audience, because you're going to want to, when you're talking about an issue, you do want to be using a consistent message, no matter who you're talking to, but it's going to be a little bit different depending on your audience, and I'll explain that. And this slide originally had a picture of Robert De Niro in Taxi Driver, that famous scene, "You talking to me?" It was a GIF and it was great, and it disappeared from my slide. So just so you know, that used to be there, but it's not anymore. Okay, why does audience matter? And feel free to put what comes to mind for you in the chat box, why audience matters. But I'll go through a few quick ones. One important reason why it's different, how you're going to talk to different people differently, is because they have a different relationship to your issue. So does this issue affect them personally or affect someone they love? Do they have the power to change a policy on this issue? Right. Different levels of knowledge about your issue. So, if you're talking to a group of HIV advocates, you can certainly assume that they have some basic knowledge about what HIV is and, how you can and cannot transmit it, et cetera. If you're talking to a state legislator, he may have no idea whatsoever about anything related to HIV. If you are, different political and values alignments. So, talking to somebody who is on the same page with you politically and values the same things is going to be a little bit different from talking with somebody who's sort of the opposite end of the spectrum for you, or, maybe doesn't know much about politics at all, but we will discuss how you can, identify core values and appeal to them that way. And also, this is really important, depending who you're talking to, they have a different relationship to you. And so that's going to make the difference between whether they're willing to talk with you for a couple of minutes, maybe they give you like 1 minute to pitch them on this issue, or maybe they're willing to sit there and, have tea with you and talk for a couple of hours. So, you'll definitely have a different sort of length of time and a different way of being able to relate to them. And also it can determine whether they know you and trust your opinion, or whether you're going to really have to convince them. Okay, so first of all, thinking about when you're talking to your state legislators, because this is, of course, we're talking about state legislative advocacy, things that you want to keep in mind when you're talking to them. you're probably only going to have their attention for a couple of minutes at the most in a lot of cases. Sometimes you'll be in a group and each person might only get a few seconds. If it's you and maybe one other person, you might have a little bit longer, but you should count on being able to have this conversation with them in like 5 minutes or less. And with that in mind, you need to be able to clearly explain what you want them to do in 30 seconds or less. You should be ready to say this. If you're spending a lot of time sort of beating around the bush or like trying to figure out how to say what you mean, you're probably going to lose your opportunity. So you really want to have this down before you even step in that office. Be ready to explain why it matters to their constituents. Because remember, they're elected, so it's always really important to them that that they get reelected, or that, you know, that they feel like they are doing something that their constituents care about. And have a clear ask. Again, this goes back to being able to explain what you want them to do, but you really need to make sure that you have a clear ask before you set foot in the office. And connect your message to values that they have publicly identified with. So if they have talked, and we're going to get more into this later, but if they have, you know, if they campaigned around, you know, making families safe and prosperous, this is something that they've campaigned on. These are values that they've aligned themselves with, and so you want to be able to explain how your issue helps them achieve those values, live out those values. And we'll, like I said, we'll talk about that a little bit more in a few minutes. And Tana is going to share some of her experiences with this with you.
Hi, everyone. I'm Tana. You know, I can tell you that talking to legislators and giving public comment, first thing that you need to do is research and find out who represents you and who your senators are. That is very crucial to you knowing who they are and what committees that they sit on. And when, you know, writing out your testimony, personal stories are the best stories to give as a personal testimony, because it's personal to you and it lines up with your values. And you know, you can challenge it by choice. And what is that outcome going to be? A challenge can either be an opportunity you had to accomplish something, or a time in your life when it was terrible, or a trial. The outcome explains how your action influence them on what you are asking them to do. You know, if you oppose something, you say you oppose. If you don't agree with something, you have the right to disagree with them. But, you know, you are the experts. We are the experts on giving that public testimony to them. And a lot of the times, like Jenny said, it's only going to be maybe 2 minutes, but go in there, write out, I mean, before you even go, write out your testimony. Have somebody else look at it and tweak it for you. Practice, practice, practice before you give that public testimony. And always, always arrive early. That way you can observe other people that are testifying before you, if you have that opportunity, that they're testifying before you, to see what questions that senator, that house person, or that senator you're speaking to um, is going to ask. And you might know the answer when it's time for you to give your public testimony. And also at the end of your testimony, you know, you always go back and visit their office um, and leave a copy of your testimony. And most of that time you're going to meet their staff, because they're either going to be in a meeting or something, but you always leave it with staff. But also you always say thank you at the end. Leave a thank you note, leave your contact information, the organization that you are with, and always lead by your values. You know, one thing that I've learned being a part of PWN is that we are the experts on how we can make a change in today's society and in politics.
Awesome, thank you so much. And just a quick reminder, if anyone has questions for any of the three of us, please use the Q&A box and we will get to them probably a little bit later. But those are great tips. Thanks so much, Tana. Things to think about. So now we're moving on to a different audience, which is community. And when I say community, this can be fellow advocates, or it could also just be like folks in the area that you live in, you know, people in your neighborhood, people in your community. So depending who that is, they still, you know, if we go back to what we were saying before, that they, you know, you may have a different relationship to them. They may already know you and trust you. Maybe they don't. They may or may not have knowledge of your issue, depending on, you know, whether we're talking about just like, you know, folks in your neighborhood or a group of advocates that you work with. But either way, things to keep in mind. How does this issue impact them or someone that they love personally? If you can show them that this is something that really affects their lives or the lives of people that they love, they're definitely going to be more interested in what you have to say and in how they can help. What values that are important to them can you connect it to? So again, we'll be talking about values in just a moment, but think about what's important to them and how can you make this issue fit into that sort of values framework. Be ready to clearly explain the outcome that you're seeking in a few words. And we'll be going into outcome versus process a little bit later as well, but you know, you really want to give them the vision of what you're trying to achieve. So instead of, you know, saying, I want our state to expand Medicaid, although that might be your actual policy goal, what you would want to say is, I want to make sure that everybody who needs to go to a doctor is able to go to a doctor without going bankrupt, right? So you're going to want to iterate what that outcome looks like, not just the process to get there. And then along with that, don't go into details about the process required to reach that outcome. Now, this is going to be a conversation that you're going to have, of course, with other advocates who are working on the issue. But when you're just talking to community and trying to get people on board with what you're hoping to achieve, you don't want to start off by talking about all the minute details. Okay, first we have to get a sponsor for this bill, and then it has to go to that committee, and then it has to go to that committee. Like, that's a lot of detail, and it's going to scare people off. First, you just want them to be on board with your vision and understand that you do have, you know, there's a way to get there, and that together we can get there. And have a clear ask for how they can help achieve the outcome. So if you have managed to get them interested and they care about your issue, they're like, yeah, these laws are terrible, what can we do? Make sure that you have a way for them to get involved. So maybe that's joining a coalition call. Maybe that's signing some kind of letter of support. Maybe that's coming with you to give testimony or to talk to a legislator. You know, maybe it's coming to a meeting that you're having, but have a way that they can actually get involved with your efforts. Otherwise, you know, you're losing an opportunity to get some help with what you're trying to do. And I'll pass it back to Tana.
Okay, community mobilization. Okay.
All right.
Consideration. Okay. Sorry. Community mobilization. Make sure you give all the information they need to take action. That is so important. We can't ask community to do something if we don't give them the tools that they need. And outreach is so important on mobilizing community. You know, everybody doesn't read emails, so you might have to text, you might have to make phone calls, whatever you need to do to get people involved, that is crucial to getting community to take action. And everyone needs to get the same information and have the same message. And it needs to be in language that is simple, that everyone can understand, and that ask must be clear, because you don't want to mobilize community if they don't have the tools that they need. It's very important.
Awesome, thank you. And Tana, since you've been working with the Texas Strike Force, do you have any sort of examples from how the Texas Strike Force has gotten folks involved and what you all have done together?
You know, I can say our Texas Strike Force, we have a rapid response team that is the eyes and the ears when it comes to watching bills. And when we get action alerts, this is how we mobilize our community. We write out the action alert. We put it in language that community and that everyone can understand. Uh, and you know, we we do if they have to go to Austin or whatever, uh, we pay bus fare for them to get there. And, you know, some of our people, our strike force people left at 5 in the morning. They didn't come back home till 10 at night. So, you know, you have to have everything that community needs to mobilize. You know, you have to do the education, you have to do the trainings, but it's all beneficial. And if everything is in line and they understand what they are fighting for, if it's something that is dear to their heart, like healthcare, Medicaid, Medicare, you know, if it's immigration rights, if it's you know, criminalization, whatever that is. But we also send out messages once a week to keep our strike force informed, keep them educated. If we need them to act on a certain bill, we send out a link to sign up and register uh, to take action. You know, sometimes during a pandemic, we have had to change how things are done. So we have had to go mobilize using Zoom, using StreamYard. Social media is very important when it comes to, you know, living through a pandemic. But it has not stopped the work itself. We have mobilized um, many people last year. um, you know, so it's making sure our community understand what the action is, and you know how to show up, and we give them all the tools that they need to show up.
Thank you so much, Tana. I see there's a couple of questions around action alerts, like what that is and what that looks like. And Crystal is mentioning the ADAP issue that you all have an action alert out about right now. Can you just explain that one real briefly?
Yes, I can talk about the ADAP. We on last week we had a town hall uh, where we needed to mobilize the strike force and any Texan on the changes to the ADAP guidelines, which is, you know, this is thousands of people that are going to be kicked off of the Medicaid assistance program. And we had no idea that this was happening. They just made these changes without any community input. So what we did was we used Facebook, we made phone calls, we sent emails to our strike force, whatever organizations that we were a part of. We sent out blasts to get people involved. And in that town hall, we had about 75 people that showed up and voiced their concerns, because when we think about changing the guidelines for medication assistance, 200%.
Tana, somehow your audio just left. We can't hear you, or I can't hear you.
Over their head before they pay for medication. So this is very damaging. And on this Friday, we have another meeting with the advisory meeting, the MAP, which is the Medication Advisory Board. and we want people to show up to that meeting, give public comment, give written comment if you can't. We send out the links for people to mobilize, to see what we can do as a community or as Texans to change this. You know, nothing is ever set in stone, but if we have enough people and enough voices, we can make that change.
Absolutely. Thank you so much for those explanations and examples. And I do see a question here about funding to send people to the State House. That will need to be another webinar. However, just quickly, sometimes if you are part of a coalition that's working on an issue, usually there are organizational members or sponsors of the coalition. And often they do have resources for mobilizations like that, for sending folks to the State House for a lobby day. So yeah, we could do another whole webinar about resources and how to find and get resources for that. But do be aware that they do exist. And often if you are working on an issue in coalition with other organizations or agencies, you should be able to find some funding. And then right now, a lot of the, I know at least in some states, they are doing a lot of their meetings virtually. And so that's actually, in that sense, this pandemic has created an opportunity to be able to interface with some of these legislators in ways that would have been more difficult otherwise, that would have required going in person. So you can also check whether your state legislator is meeting virtually, or if you can do virtual meetings with legislators, even if they're meeting in person. Okay, and so I'm going to go over the media part relatively quickly because the reason for that is because I think if you are going to be a media spokesperson on your issue, I would love to work with you one-on-one, especially if you're a PWN member working on PWN policy priority issues, because there is quite a bit of preparation that needs to go into talking with media. Even if you have experience with speaking with media, it's still, I think, somewhere that we all have work to do, and we can all benefit from, talking with somebody else and practicing and putting together talking points. So I'm just going to go through this part a little bit, kind of briefly, but if this is something that you're interested in doing or that you're already doing and you would like assistance with it, or you'd like to improve, definitely send me an email, get in touch with me, and I'll be happy to talk with you one-on-one or in a small group. But considerations when you are talking with media. Number one, are you the best person to speak to this issue or to the legislation that you're working on? In some cases, maybe yes, especially if you're prepared. In some cases, you may not be the best person for that. So don't just assume that you have to speak with the media, even if they ask you directly. It's always an option to put them in touch with somebody else who's better positioned to speak on the issue. So, yeah, don't assume that you have to do it. There may be someone else who's better to do it. If you are going to do it, you want to work on your message with a communications professional or a trained spokesperson ahead of time. And you're going to want to practice, practice, practice. You're going to want a sound bite. So this is going to be sort of similar to what we were saying earlier in terms of talking with legislators and having a really short, concise message. It's going to be similar to that. And you're going to want to practice it over and over again. And you're going to want to interject it into your conversation with the reporter frequently. So this is definitely something that you want to prepare ahead of time. Be ready to clearly explain in 9 seconds or less the outcome that you seek. So this is going to be your soundbite. And like we're saying, the outcome you seek, maybe this is everybody who needs to go to the doctor can go to the doctor without going bankrupt. Maybe this is every person living with HIV has access to the life-saving medications that they need and the care they need. So rather than saying we want to preserve ADAP eligibility rules, you want to say we want to make sure that all people living with HIV have access to the care they need. That's the difference in process and outcome. And again, don't go into detail about process. It's going to be confusing. If the reporter uses that part, it's not going to be persuasive or impactful for the people who are reading the article or watching you speak on TV. So just, you're going to want to focus on outcome, not process, and we'll get into that in more detail in a moment. And you're going to want to lead with values, and you're going to want to come back to values. And we're about to speak about values right now. And so again, yeah, I'm not going to spend a lot of time on media, but if you are interested in doing media on your issue, or you're already doing it, and you would like some assistance or just someone to practice with, I'm here for that. So you can get in touch with me directly. Okay, moving on. Now we're going to actually talk about this message. What is a message? When we talk about messaging for an issue, we're thinking about, like, how can we sum up what we're trying to achieve in just a few words that anyone can understand and that people are going to relate to and be excited about and want to participate in. And one place that messages tend to fall short oftentimes is that we try to get to make it where, like, nobody can disagree with us. We're saying something that everybody can be on board with. Unfortunately, our world doesn't work that way. People have big differences in their values and what they're trying to achieve. And sometimes if we try, you know, I'm sure folks have heard, if you try to please everyone, you end up pleasing no one. That happens with messaging as well. So if you're trying to make something that everybody agrees with, it's going to be something that's so bland and boring and meaningless that it's meaningless, that it's not effective. And so I love this quote from Anat Shankar-Osorio. I call her my messaging guru. She, the stuff we're about to go over now, she wrote, I always try to give credit where credit is due. So this is a quote from her: "A great message doesn't say what's already popular. A great message makes popular what needs to be said." Okay, so you're not just trying to say what everybody already agrees with, you're trying to get people to agree with what you are trying to achieve. And that's the purpose of our message. So what I'm about to go over comes from this wonderful handbook called 8 Messaging Principles. Sorry, these are the 8 messaging principles. They come from the handbook called Messaging This Moment, a handbook for progressive communicators by Anat Shankar-Osorio and the Center for Community Change. This is available to you on our website. I have the address up here. There will also be a follow-up email that we send out either later today or tomorrow, and I will make sure that this link is in that email as well. But this, I definitely encourage everyone to read through it. It's not super long. It's very easy to understand. And I think it's really, really helpful. It gives a lot of really helpful messaging advice. So we're going to go through these pretty quickly. But if you are interested, I definitely encourage you to go back and look at it in more detail. So the number one, and I can't stress how important this is, and I'll come back to it over and over again: lead with shared values, not with problems. This is something that Anat Shankar-Osorio always says, that, you know, folks have 99 problems and they don't want yours. So if you just come right off the bat with, here's this big problem, oh my God, this is what's happening. A lot of times, you know, unless the person is already being affected by it, they're just going to be like, whoa, I don't, you know, I can't do anything about that. I've already got enough going on in my life. So what you want to do is introduce the problem by stating a value that the person you're talking to shares with you, and to sort of explain what that means. We have to look at what common core values are. So a value is exactly what it sounds like. It's something that is important to people, that they hold dear to them. So some of the most common ones are fairness. Okay, most people want things to be fair, but do keep in mind that fair means different things to different folks. Some people think fairness means that everybody has what they need to live comfortably and happily. Some people think fair means nobody gets anything for free and everybody has, you know, everyone has to do this, that, or the other to get things. So just because we all believe in fairness doesn't mean we all have the same concept of what fairness is. But fairness is a value, and it's something that it's a value that we can use to introduce what we are advocating for. Personal responsibility. This is a huge, huge core value, especially in the US and other, you know, very individualistic cultures. And it's not a very helpful one for what we are typically trying to achieve, because we are usually working to achieve things that benefit our community, especially that benefit marginalized people or people who are not sort of, starting with all of the privileges that are possible to start with in the world. And so I would actually really discourage folks from leaning on personal responsibility as a value that you're trying to tie into your message. And this is something that I've actually changed my viewpoint on this, because I used to think that it was, maybe it's helpful to tap into this value if it's something that they already believe, but it actually works against us in a lot of cases. And so I actually advocate for folks not to use that value in their framing. Loyalty is one, patriotism is a common value, faith, big one, family, strong families. This is a really important one, and it's very unfortunate that conservative and very reactive, that side of the spectrum has co-opted the idea of family, or the idea that they actually champion what's best for families, because family is something that's important to almost everybody. And I think that we all can agree here that most people love their families, they care about their families, and they want the best for their families. And we believe that the things we're advocating for, whether that's, healthcare access or reproductive rights, or like ending mass incarceration, we believe that these things are beneficial to families. And we shouldn't be afraid to say that. We should use family as an important value when we're talking about the issues that we care about. Compassion and empathy, being able to have empathy for other people. Hard work, that kind of goes up there with personal responsibility. I probably wouldn't use that most of the time as a frame for the issues that we tend to work on. Public accountability. Personal liberty, that's a favorite in the US, but this one actually can be helpful to us in a lot of cases, so I don't hate that one. Equal opportunity, justice kind of goes along with fairness, but most people believe in justice. Of course, they might have different ideas about what that means. Tradition, dignity of character, truthfulness, honesty, public health, civic participation, community. This is one that we care about a lot. So these are all core values. Redemption stories people like a lot. But these are all just core values that we want to think about when we're shaping our message. And an example of this, so here I've got on the next few slides, there's going to be some, instead of this, say this. And so just to sort of give you a caveat around that, when I say instead of this, it doesn't mean that what you see underneath that is wrong. It means that there's a better way of introducing that to the people you're talking to. And so with that in mind, this example, the criminal justice system imprisons Black and Latino people at an alarming rate. Okay, that's actually true, right? But it's not, when you say it like that, people who they already have things in their mind about what that means. And for some people, what all that means is that Black and Latino people commit more crimes. And you're not necessarily changing their mind about that by framing it in this way. So instead of saying that, try this. The US is a nation founded on an ideal. All people are created equal. And now you can get into the actual problem part, and we'll get to that in a moment. But start with the value that everyone is created equal. We should all have equal rights, and we shouldn't be subject to different rules. Or for example, instead of saying America is the only developed nation without paid parental leave. It's true. But what about starting with, most of us believe family comes first. What we're doing is we're putting the frame into the minds of the people that we're talking to. We're priming them to think about the issue in the way that is going to connect it to their lives and make it meaningful to them. And so if we prime them to think about their family, what comes to mind? Maybe they think about their kids or their grandkids. Maybe they think about their mom or dad or grandma. Maybe they think about, their sisters, brothers, cousins. So priming them to already be thinking about these things that are meaningful to them is going to make it easier to talk to them about why paid parental leave is important. Or instead of saying the gap between rich and poor is at historic levels in this country. Again, it's true, it's not wrong, but people may already have in their mind the reason for this as well, because the poor people are lazy and the rich people work hard. Now, we know that's not true, but there are people who think that way. So instead of just starting off with that as your problem, try framing it. No matter our differences, most of us want pretty similar things. You know, what do we want? We want our families to be healthy and happy and have what they need. We want, if we have children or grandchildren, we want them to have opportunities and to have, you know, what they need to be healthy and successful. So prime people to think about, you know, these values and the way we want them to see these issues. And Tana, if at any moment you want to add something, please jump in, because I'm kind of like racing through here.
Will do.
Okay, the second messaging principle, and this one is also pretty important, is bringing people into the frame and offering clear villains and heroes. And what that means is that a lot of times we talk about things as if they just happen by themselves, as if they're some kind of inevitable consequence of nature. So if we say, for example, 3 million jobs have been lost, or, you know, the unemployment rate rose by 2%. It makes it sound sort of like inevitable, like there was not, you know, that human beings were not responsible for this, and perhaps that there's not much that human beings can do to change it. And so you want to really put the focus on who's responsible and who has the power to change things, and also who's trying to change them. So instead of saying jobs were lost, you can say CEOs fired more people. Who's responsible? CEOs.
And also, when we think about job loss, COVID has made millions of people lose jobs during this pandemic also, and businesses.
Absolutely. And so in certain cases, it may not, you know, especially in the context of COVID, maybe, you know, the fact that people are losing jobs, maybe it's not necessarily the owners of the companies, but maybe it's, you know, it's the lawmakers in our government who are not helping small businesses stay open when they, you know, feasibly cannot be open to the public, right? In that case, we just want to make sure that we're assigning the responsibility where it lies, and being clear about who has the power to change those things. Thanks for inserting that, Tana, because it's important that right now we're in a different context from what we usually are.
Yes.
So instead of saying people of color are overrepresented in the criminal justice system, or Black people are imprisoned at higher rates than white people, be specific. Who's responsible for that? Police target Black people for surveillance and traffic stops. Prosecutors impose harsher charges on Black people than white people for the same offenses. Judges impose harsher sentences on Black people than white people. These are just examples, but just to be clear about where the responsibility lies, that it's actually decisions that are made by human beings, which means that other decisions can be made that have different outcomes.
And also, when we think about that, laws that are being created to Black people, so the laws itself that the government put in place impacts racial justice and all of that in place.
Absolutely. And then the third messaging principle: create something good. Don't merely reduce something bad. I won't spend a ton of time on this. I think this one's relatively, I don't know if obvious is the right word, but sometimes we talk a lot about what we're against, but we talk less about what we're for. And so instead of saying we're against cutting healthcare, we can say we are for creating a system where everybody gets the healthcare they need and nobody goes bankrupt because of it. So just and this is something I always try to work on, but if we're against something, I want us to always be proposing something else in its place. To me, it's not enough just to tear things down. We have to be building something to replace it. Otherwise, there's not, maybe we're reducing the bad, but we're not creating anything good. And it's just from a messaging perspective, it's better to have a solution to offer than to just point out problems. And I think people can relate to that. Like if I send someone something that I've worked on and they say, well, this sucks. This idea doesn't make any sense. This is not well written, but they don't offer me any kind of like, how can I make it better, right? So it's only helpful if you actually tell people what it should look like, how you can improve it. So for example, instead of saying improve pay and working conditions, you can say people should be paid enough to provide for their families. Instead of saying paid family leave, you can say everyone deserves to be there when a loved one is sick. Because that's what it's all about. It's not just about, being able to take the time off work. Why do you need to take the time off work? So that you can be there when somebody needs you.
Yeah, that's for mother, brother, sister, babies, our children, anyone. And they deserve to have us there when they're sick. And companies and businesses should put that in place for people to be able to be there for their loved ones.
Yeah, but we can also do it through legislation. Colorado actually had a ballot initiative. Well, that's not legislation, that was a ballot initiative. Barb, I don't know if you want to say anything real quickly about that.
Yes, so paid family and medical leave was part of our advocacy at the last election, and we had an opportunity to talk to a number of Colorado voters about the importance of paid family medical leave. And what we realized was that a lot of people just didn't quite understand. So a lot of our messaging is about being able to educate people and to message it for the impact that it'll have on both their lives as well as the lives of their children. That was a very powerful connection that we were able to make to talk about, not just, if you are sick that you need to take time off, but if your child is sick or your parent is, and that really made it possible for people to connect our message to their actual lived experiences, and especially to their opportunities and what has happened with COVID. A lot of people have needed to take time off and weren't able to be paid for it. So it certainly was a direct connection, and most people had some experience with how it would shift their lives. But absolutely, when we said paid family and medical leave, people were like, no, I'm not so interested. But when we said, do you want to be there if you need to take care of a parent when they get sick, or if your child is sent home from school, the really giving them that personal connection made it so much easier and a better connection for sure.
Yeah, thank you for that. I see a question here. What if we don't have a solution to offer, maybe because it's never been done before? Is it good enough to say something like, allow us an opportunity to have input in the process? That's a good question. I don't think when I say to have a solution, I don't mean we necessarily need to be able to say, to provide the entire roadmap for how we get there, but we should be able to sort of articulate our vision. And so, if, for example, to use healthcare as an example again, we don't have to be able to to verbally write out a bill per se, but we can talk about having a system where everybody can go to a doctor when they need to without going bankrupt. So I think it's really about and sometimes we can use examples for other places that are doing this effectively. There are many, actually, like almost all other countries do this better than we do that on that particular issue. So I think we can use examples as well. If we do know the system that we want, of course we can say that, but I think just being able to articulate the vision is important rather than just naming the problem. I hope that makes sense. This one is really important because I hear people, and it's really tempting to do, especially if we do a lot of work in the quote unquote in the weeds, like in writing legislation or in the different processes that it goes through along the way. Sometimes we tend to get very bogged down in the details. Or even just, we're so used to advocating around issues that we just get hung up on the process of getting there instead of talking about what we actually want it to look like when we're there. So just reminding to focus on the outcome, not the process. We've already looked at a couple of examples along along these lines, but one thing, people talk a lot about the safety net, the social safety net. A lot of us know what that means, but not everybody does. And even for folks who do, it's not always, it doesn't necessarily evoke clear images in our mind about what that means. So instead of saying we want to protect the safety net, we can say, we can name the things that are part of that. So food, housing, medical care, right? We want to make sure everybody has a roof over their heads and food on their tables. We want to make sure that if someone falls on hard times, that they're not going hungry or living in the street, right? So just being really clear about what we want to see. Safety nets refers to the programs that help us get there. So maybe that refers to public housing in Section 8 and SNAP, food stamps, and Medicaid. Those are sort of process things. The outcome is that people have food on the table, a roof over their heads, and they can go to a doctor when they need to. So just to bring the focus back to that.
That's where economic justice comes in. That's where we have to change laws.
Yep, absolutely. But when we talk to people about changing the laws, that this is why, because we want people to have these things.
Yes.
Mm-hmm. And instead of talking about block grants, Medicaid block grants, that's super processy. We don't want to go into a room full of people who do not directly work on this issue and say, block grants are coming and they're terrible. Instead of saying something like that, we talk about what the block grants actually do. And I'm sure there are people on here who probably don't even know what that means. I don't want to spend a lot of time on it because that's not what the webinar is about, but basically the block grant is that's a system where the federal government would give each state a certain amount, a fixed amount of funding for their Medicaid program, and then the state just has to either deal with that or supplement it with their own funding, and they can change eligibility rules accordingly, as opposed to a current system where the funding is allocated based on the people who need it. And so it's bad, but most people don't even understand what it means, and it definitely doesn't, sort of convey to people how important it is or what it would do. So instead of talking about Medicaid block grants, talk about the fact that it removes people from care, or it denies people the care they need, or it forces people into debt to get the care that they need. Just outcome. Repealing and modernizing HIV criminalization laws. This is one that a lot of our members work on, and that PWN works on in different states. It's what we're trying to do, right? We're trying to repeal the laws or modernize them. But for people who are not, already very familiar with this, or who don't really understand what they are, or why they're bad, what they do, what is it that we're trying to achieve when we change these laws? One of the big things that we're trying to achieve is to make sure that nobody is afraid to know their HIV status or share it with a partner. And then we can get into, from there, we can move into the reasons why the laws are a problem and why they get in the way of that outcome. And that's why we're trying to get rid of them, right? But instead of just starting off with like, this is what we're trying to do, why are we trying to do it? I won't spend a lot of time on this one. Describe what you seek, not what you oppose. That is that's in some ways, it's sort of like what we were talking about just a moment ago about offering solutions, but it can also be a little bit different. Okay, so instead of saying, for example, Medicaid work restrictions don't increase employment, it's true, but we can say instead, everyone deserves access to healthcare when they need it, whether they have a job that provides insurance or not. So talk about, so instead of just talking about why we don't like Medicaid work restrictions, again, let's go back to our vision. What do we want to see? What's the outcome that we want? Talk about what we're for. And this one also, okay, for example, I've heard people say things like this. HIV criminalization laws treat people living with HIV like sexual predators. This is true. And if we use this as a public message, there are a couple of parts of this that are going to stick in people's minds, and it's not going to be very helpful for us. And those things are people living with HIV, sexual predators. There have been studies done that show, and focus groups and stuff, that show that people will remember the words in the sentence, but not that little not. Or, so if you say, for example, this is a pretty famous example that I think a lot of folks are familiar with, when Richard Nixon, during the whole Watergate thing, went on TV and said, "I am not a crook." What do you take away from that? Richard Nixon, crook, right? He didn't really do himself any favors by saying that. So when we talk about what we what we oppose, you don't want to use the opposition's words, because people will remember that, and you're actually inadvertently reinforcing your opposition's message. And we don't want to say what we're not, we want to say what we are. So just to be really, really careful about that. And if folks are interested, there's a wonderful messaging book that is called Don't Think of an Elephant, by George Lakoff. It's very short. I think it's like maybe 30, 40 pages, very easy to read. And even the title basically says so much, right? Don't think of an elephant. If you say to someone, don't think of an elephant, what is the very first thing that pops in their mind?
Thinking of the elephant.
The elephant, right? So that's just a really clear example of why we don't want to use our opposition's words, even if we're saying that what we are or what we believe is the opposite. So instead of saying that, you can say, we want to make sure nobody is afraid to know their HIV status and that they get the care that they need. Investing in healthcare access and using tested public health strategies improves the lives of people living with HIV and reduces transmission. A little bit of a long example, but this is a better message than just saying HIV criminalization laws treat people living with HIV like sexual predators. Better message. Introduce particular circumstances and harms after the shared value. Won't spend a lot of time on this one, but basically you just don't, instead of just saying this bill is going to hurt this group of people, talk about the values first, and then introduce the problem as a way that this thing is interfering with this value that we all hold dear. And some of some terms you can use sometimes in doing this, things like everyone means everyone, no exceptions. Everyone deserves a fair shot, no matter your zip code, no matter what you look like or where you come from.
Exactly, we are all human beings.
Yep. And then, okay, this is sort of like what I said at the very beginning. Alienating the opposition without provoking backlash from them is not merely acceptable, it is necessary. What that means is we don't want to just say what everybody can agree with. We want to set ourselves apart from our opposition. We understand that there are going to be people who are opposed, not only to the specific thing, the specific piece of legislation that we're advocating for, but also against the vision that we have. And that's okay. And we need to distinguish ourselves from our opposition. And so that means we can't please everyone all the time, and we can't be scared of some people being turned off by our message. It is going to happen, and that is actually desirable. And this is something, if anyone has noticed, there is a certain, on the right side of the political spectrum, conservatives are not afraid of provoking backlash. They do it all the time, and they do it on purpose. A lot of times we talk about throwing red meat to the base. They do this all the time. We who are more progressive tend to be a little bit scared of doing that sometimes, but I think we have to be willing to put ourselves out there and say things that people are going to disagree with, and it's okay. We're setting ourselves apart and being clear about our values. And the last of these eight messaging principles, get less modest. Won't spend a ton of time on this either, but we love to sort of hedge. Oops, sorry. There was an example there that disappeared with all my other stuff. But instead of saying things like, we work to achieve this, say, we achieve this. Instead of saying, we are striving to create a system, say, no, we are creating a system. Just take credit for it, even if it's still a work in progress, because everything's a work in progress. Take credit for it. As one of the best expressions, carry yourself, express yourself with the confidence of a mediocre white man. Okay, don't be afraid of saying that you actually do these things, not just that you're trying to do them or you're working on it or you're hoping for it. No, you're doing it.
Yeah, credit. That's like creating change.
Yep. We are creating change, and we shouldn't be afraid to say we are. We're not trying to, we are, we're doing it. Quick time check. Okay, so I see, yeah, we're getting a little low on time. I'm not going to go through all of these. I'll just do a couple of them real quickly. These are sample narratives, and there's a whole bunch of them in that guidebook that I took this stuff from, that I'm going to send the link in the follow-up email. Strongly encourage folks to read through it if you're interested. But this is just one of them. So the value in this case would be fairness. And so starting with the value, which is this little purple symbol you see here, we say America was founded on the idea that people are created equal. That's why access to the medicines we need to live healthier should be equally available to all. Getting sick and needing care doesn't depend on what's in your wallet. No one should go into debt to get well. Now the little yellow symbol, this is where we introduce the problem. But today, the GOP wants to pick who gets to live long and in good health and who will struggle to get care for themselves or their family. They see a life in California, a prosperous state that pledges to look after all of its residents, as worth more than one in Mississippi, where state lawmakers are eager to block people from the care that they need. And then the last one, where you see the little sort of aquamarine symbol, that's why we are, and here's your call to action. That's why we are fighting this bill that would cut Medicaid, or this is where you're going to get into that thing that you're trying to do. But you see how it comes all the way at the end. So we've introduced that value that people care about. We put that in their minds. Yeah, that's right. We do want everyone to be able to do this. Now we've got the problem. Oh my God, they're trying to do that? That's terrible. And here's our solution. That's why we are fighting this law, or that's why we are introducing this law, right? And here's what you can do about it. You can sign this petition. You can come to this meeting. You can make a call to your legislator, whatever that ask is. I'm gonna just kind of do several of these. I'm just going through quickly. I'll do one more and we'll finish up that part. So let's see, some other people who work. Actually, okay, wait, hold on. Children have rights. This is on childcare. Parents want the very best for their kids, and our leaders ought to want the very same. That means childcare you can trust, no matter your income level, and the right to care for your loved ones while still making ends meet. Now we've got our little solution in here. That's why we are endorsing the blank, whatever that is, childcare plan, which provides support to make great care affordable no matter your income. Now we've got the problem. Meanwhile, Trump's plan, Trump is no longer the president, so this is already a little bit dated as of about a week. But meanwhile, Trump's plan is another kickback for the already wealthy, while people who work for a living are left scrambling. And then coming back to a value, all children have rights, not just those whose parents happen to be wealthy and well-connected. Okay, so starting with values, ending with values, we have the solution, we have the problem. You see that in this example, the problem and solution are inverted, but it's the same general idea. You want to start with values, then you can introduce your problem, your solution, and you want to tie back to values as much as you can every time. And so a quick note about scarcity versus abundance in messaging. We have a tendency to to fight for crumbs. And I had a great GIF here that disappeared when my slides got all messed up somehow, which I'm still upset about. But it showed a guy there's one guy who's got a big stack of Oreos, and then there's a guy in the middle who has like 2 Oreos, and then there's this guy over here who just has like a few crumbs, or he has like one, like half of an Oreo. And the guy with the big stack of Oreos, when the guy with 2 Oreos is looking at him, he's over here pointing at the dude with like half an Oreo. Right, this is what they do. So it's this idea of fighting over crumbs, that like there's only so much, and we can't, that we can't have any more than that, and therefore, we're going to have to fight over these little scraps. And we tend to do that in a lot of ways in our messaging. And what it ends up doing is it pits people again who should be working together against each other. And we've seen this sometimes when it comes to, for example, HIV funding advocacy. Sometimes it ends up being this idea that we have to be sort of competing with other chronic conditions or diseases for funding. So, maybe it's we're fighting over funding against, cancer or Alzheimer's. Resist the temptation to get into this competition of which of these is more serious or which needs the funding more. Instead, approach it from the idea of, we have the resources in this country to address all of these things, right? They're all important. It's not about pitting people living with HIV against people with cancer or people with Alzheimer's. You know why? Because those can be the same people anyway. And we're all important, and these things are all important, and there's enough. We have enough in this country to take care of everybody. It's a matter of the will to do it. And so resist the temptation to think about that we sort of have these finite resources and we can only do so much and we need to compete with each other for that. Think of it more as, we have enough for all of us. Budgets are about priorities. We can make these things happen. But we don't want to compete against each other. We want to work together to make sure that we have what we need for everybody. Okay, let's see. Yep. Identify and protected. And so this sometimes shows up even in contexts that don't involve government spending. It's really obvious when we're talking about funding, but it also happens even when around marriage equality. I don't know if folks remember this, but there was this sort of argument that if same-sex couples can get married, then heterosexual couples are now somehow like meaningless or no longer exist or no longer have rights. This idea that like, if that somehow extending the same rights that some of us already have to other people is taking away from those who already have the rights. It doesn't make any sense, and yet this argument got used over and over again. So don't take the bait. Like, there's enough love in the world for all of us. We can all have, we can all be married to the partners of our choosing. We don't have to have this idea that like marriage is only this, or same goes with affirmative action. Yeah, just the idea is that it shows up in places that aren't even about money, and we just need to be able to like identify them and reject that sort of messaging when we see it.
Yeah, because love is love, no matter what.
Yep. Absolutely. There's enough for everybody. Okay, and then quickly, sort of wrapping up a lot of what we've been talking about, do's and don'ts. Do lead with values and come back to values. That's why we're doing the things we do, because we have these values and they are a reflection of our values, and we should not be afraid to say that, and we need to say it over and over. Do talk about your personal connection to or a special knowledge of the issue, as Tana said earlier. Use your personal story if you're able and comfortable in doing so. It's very effective. And it definitely, it engages people, it draws them in, and it illustrates why the issue is important. So don't be afraid to do that. Obviously, as long as you're comfortable doing it. Do focus on the desired outcome, not the process to get there. What do we want to see? We want to see a world where people living with HIV get the care that they need and deserve. We want to see a world where no one's afraid to know and share their status. We want to see a world where everyone can go to a doctor when they get sick. Do have a clear ask. What is it that you want the person you're talking to do? Do prepare and practice an elevator pitch or a soundbite, depending who you're talking to. Do offer solutions, not just the problem. And do use clear, simple, and easy to understand language. The don'ts. Don't get into details about the process, especially if you're, not talking to an audience that needs to know all the details. Don't lead with problems. Don't assume that your audience understands your issue or has extensive knowledge about your issue, particularly around HIV. Don't make assumptions about those things. Just explain them clearly and concisely. Don't use jargons or acronyms, especially if you're talking to people who are not, involved in the same work and advocacy that you do. Don't think you have to know everything about an issue to advocate for it. Sometimes I work with members who feel very stuck because they don't know exactly, for example, how the Medicaid work requirements will work. They feel like they can't advocate around this issue. That's not true. You can. You can still have a position and you can still advocate. You do not need to understand every single detail of the bill or the process. You just need to know what you want to see and have an idea of how we can get there. And don't think that everyone will or should agree with you. They won't, and it's okay.
No, because you should be able to agree to disagree.
Yep.
And still have the same outcome.
Yep. And I just wanted to quickly throw a note in here about U equals U in the context of HIV criminalization. So I think, and we don't have a lot of time, and I'm happy to discuss this more with folks offline. So please feel free to email me, but U equals U, undetectable equals untransmittable, super true, scientific, super important. It can be useful in an HIV criminalization conversation, but only in the sense of offering public health solutions. So it's good to educate our lawmakers about this, because a lot of them, if not most of them, don't even know that someone who is on effective treatment and is adherent to the regimen cannot transmit HIV. Most of them don't know this. It's good for them to be educated to understand it. When we talk about the solutions to ending the epidemic, we're talking about access to care. This is an appropriate place to talk about why U equals U is important, because it helps people living with HIV live long, healthy lives, and it prevents transmission. And that's why we want everyone to have access to care and to be able to go to the doctor and get their medications. We do not want to introduce it in the sense of this is the reason why we shouldn't be sending people, we shouldn't have HIV criminalization laws, because what that can do is you can unintentionally be creating the idea in the lawmakers' heads or in the community's heads that, oh, okay, so it's okay to send these people to jail, but if the people are on their medication, then no. And we don't want to be creating these two separate classes. We definitely want to avoid that. So yeah, just to be really careful about how we use that, to use it as a way of educating about HIV today, a way of talking about public health solutions and why access to care is important, why services to stay in care are important, but not sort of in the sense of like the law needs to talk about this.
And it's one thing that we've learned in doing advocacy with lawmakers is that a lot of them do not know anything about HIV. This is when session is in motion. This is the time to educate them on HIV, what it is and how it affects our community.
Yep. Absolutely. Don't assume that they know, because they probably don't. You can definitely educate them. You all are experts. So that was a lot. went through that pretty quickly. There's a whole lot of information, and I could definitely talk with you for hours longer, but I won't. We are getting right at time, I believe. Yep, get very close. We have a couple of minutes, and I'm happy to stay on a little bit longer if folks have questions. But before I open that up to questions, quickly, we do have a lot of resources available for this. We went over a whole lot in a very short period of time. The good news is you can find all of this and more on our website. So we have this whole how-to guide to advocacy for people living with HIV on our website called Claim Your Seat at the Table. I will send the links in the follow-up email, so don't worry about trying to write it down. It will be coming to you in an email, but do check it out. Part 4 specifically is around communicating about your issue and getting your message out. And so there's a lot of really helpful stuff in there, including videos. And then our Communications Resource Center has the handbook that I was pulling heavily from, as well as a whole bunch of other really helpful resources. And Tana also has a great sheet about preparing for talking with legislators. And so that will also be linked in the email that goes out. And it's just like a really helpful one-pager about ways that you can get ready to talk with your legislators. So you will be receiving that as well.
And always you can reach out to all of us to get help with testimonies, whatever you need. You can reach out to PWN and anyone and get help.
Absolutely. Yeah, totally. And in that advocacy guide I was just mentioning, there's even, we have videos of members giving public testimony at hearings. There's a lot of great resources, and you can check those out. And then, yeah, definitely get in touch with any of us. If specifically around media, if you have a media request or you're trying to get media for your issue and you need help preparing for that or getting, you know, any kind of advice around it or just to practice, please do send me an email. My email's up here. Some of you may have my phone number. You can call or text me as well, although email tends to be a good way to reach me. But I'm here for that, and I'm always happy to help. And if you know it pretty far in advance, that's awesome. That's the best case scenario. Even if it's something that pops up at the last minute, try reaching out anyway, because if it's at all possible, I will jump on the phone with you, even if it's just for a few minutes. So please don't hesitate to reach out. It's what I'm here for. And yeah, just want to, I know we're at time, but I can stay around for a couple minutes. If folks have questions, please go ahead and ask. And if not, make sure to see the chat. Thanks for joining us. Oh, and yes, there is an evaluation. Let me see. Oh, sorry, Barb, you're doing these last 2 slides. Sorry.
Yep, that's all right. Just wanted to invite everybody to join us for our next webinar, which will be February 17th. We'll be talking about ways to mobilize in your community. So we've talked about mobilizing to provide testimony, and this is going to be some real grassroots efforts at how to mobilize and how to really work around the legislature. So that'll be the 17th, and there'll be a sign up for that. And then we also have a evaluation that we would love for you to fill out, and we went ahead and put that link in the chat box. I will go ahead and put it in again so that it's absolutely at the very bottom. If you can take a few minutes, it should be very quick, no more than about 3 or 4 minutes. Just let us know how we did. That always helps as we are learning and able to figure out how we want to shape these conversations moving forward. So again, want to thank everybody for joining us today. Want to thank Jenny and Tana for sharing your very practical tips, as well as a lot of broader thoughts around how to best prepare and to shape messaging. As we have talked about today, we want to be able to match the message to the audience and to do it in a way that is the most effective. And so hopefully this was helpful. Jenny, Tana, anything you'd like to add before we go ahead and end?
You know, I would like to say thank you to everyone that joined us today. And if anyone needs help, I'm here. I'll put my email address, whatever, and let me know what I can do to help. We're in this fight together.
Thank you so much. Yeah, big thanks to Tana for joining us here and sharing her experience and her expertise. And thank you, Barb, also for being here and for sharing your experience in Colorado. And also you've been doing this for many years and have a ton of experience with it. So really appreciate both of you. And yeah, we're here, and thank you all so much for attending, and be on the lookout for a follow-up email. It will be going out either later today or tomorrow, and it will have all of these links, the evaluation, the resources, everything that I mentioned you would be getting, you will get, as well as the recording and the slide deck. So yeah, stay tuned for that. It'll be coming your way within the next 24 hours. Thank you all so much. Hope everyone has a great day.
Bye, everyone.
Bye.